Okay. Oh, that person now. Okay. Significantly worse hygiene condition exists in pathological condition. Example, in the cases of carious lesions, gingival papilla hydrotrophy, or the presence of gingival and periodontal pockets. Gum inflammation most often begins in places where the oral hygiene is difficult, from the gingival papilla in the interdental spaces and from the gum margin. The state of the oral hygiene is determined by acquired saliva pellicle, dental plaque, white plaque, tartar, food leftovers. Elimination of dental plaque can be achieved by preventing their formation or removal. Ways to clean your teeth: mouth rinsing, eating cleaning foods, brushing teeth and flossing, using additional hygiene tools. Let's talk about a little bit about mouth rinsing. It removes almost half of food remains. If performed for a longer time, it may dissolve and completely remove sugar from the mouth. Rinses should be used to support daily oral hygiene. The advantage of each rinse is that it lasts longer in the mouth than toothpaste. It provides additional protection against caries and freshness breath. However, it's not an effective method of maintaining oral hygiene, as an exclusive method recommended only when brushing teeth is impossible in cases of acute gingivitis. Mouth rinsing, the importance of mouthwash changes significantly when certain chemicals are added to the water. When the mechanical action of the water streams itself, although not very effective, is enhanced by a chemical action, depending on the added ingredient. Examples of such effective rinses are preparation containing 0.2% chlorhexidine solution, for example, is Corsodyl, or 0.1% Eludryl, with antibacterial properties. Eating cleaning foods. It has been found that certain food products, especially some fresh fruits and vegetables, effectively remove soft coating from teeth. Apples, carrots, radish, and celery work this way. Nuts and wholemeal bread have a similar cleaning effect. However, they can be recommended only as additional conventional way to clean your teeth after a meal, especially with a sweet dessert, when it's not possible to use a toothbrush or floss. Brushing teeth and flossing. It is most effective way to maintain oral hygiene. It allows you to remove most of the dental plaque, not to mention food remains and soft coatings. The effectiveness of toothbrushing depends on the condition, quality of the toothbrush, and the frequency and method of brushing. Roll methods, of course, I think everyone knows it is indicated in the patient when with periodontal diseases that is not accompanied with significant swelling or hyperplasia of the gum. And there are no distributions in the shape of the alveolar process. In such condition, the bristles of the tooth skip cleaning and the cervical part of the tooth in the immediate vicinity of the gingival service or periodontal pocket. Fondness method. It's relatively rarely recommended to adult patients. The circular movements of the brush placed on the gum at the 90-degree angle are too broad and uncontrollable. This method can be recommended to disabled people who would otherwise be unable to master dental cleaning techniques, mainly children. Stillman method. The technique is currently considered as a massage and cleaning technique. This method is especially recommended with the thin gum are detected and teeth are exposed. Gum recession. Bus method. It enables the best cleaning of the gingival groove from the bacterial plaque. This method requires a soft, multi-tufted brush with equal length bristles in brushes. And charter methods is mainly a method of massaging the gum in which the bristles lie partly on the gum and partly on the tooth crown. The method is especially recommended for the patient with periodontal disease who experience gum recession and loss of the gum contour. It is advisable to use a soft toothbrush that does not damage the remaining zone of attached gingiva and marginal gingiva. Brushing teeth and flossing. Depending on its quality, frequency, and method of brushing, the brush usually wears out within a period of 2 weeks or 4 months. The brushes should be changed of average at least every 3 months. It is recommended for you to ask your patient from time to time. They should take a brush for the visit and show you how it looks like, and then you can recommend it to change or not. Brushing teeth and flossing. This is my some tips that I would like you to give you, not only a lecture that I can read and you of course read, but I always want to give you some clinical tips. The first tip is to tell the patient to change the hand he used to brush his teeth. I think we already talked about it during the seminary, but I will repeat it. If he is right-handed and usually use the right hand, tell him to start using his left hand. This will allow him to increase his concentration when brushing, eliminate all the bad habits, and the activity itself will no longer be automatic, often performed carelessly. This is a tip that we are also checking, making a scientific work on our department. The second tip, each of us has a favorite quadrant of our teeth from which we always start brushing and one of which we end and which is always the last cleaned. Tell the patient to start brushing his teeth from a different quadrant each time and move clockwise. This will allow him to eliminate the quadrant that is constantly not cleaned and will increase his concentration when brushing. Tip number 3: an electronic toothbrush should only be recommended for people with mobility impairments. Patients should be reminded not to make additional brushing movements when using an electric toothbrush. If they are unable to apply the toothbrush to individual teeth and do not perform additional movements, they should stop using the electronic toothbrush in order to avoid damage of the periodontium. For me, it's very important, especially I talk about this with the patient who loves the electric toothbrush. You need to explain them how they should use it, because sometimes they destroy the gums thinking that they spend a lot of money and they have the best toothbrush, but from time to time it's really needed to explain them how to use it. The tip number 4 is ask the patient to floss at least once after brushing. When he sees much residue remains between his teeth, he will definitely start flossing.
Face mask, but it seems like they put a bunch of other stuff in here. So let's see what's inside. Okay, first we have a ton of the pink collagen gel masks. These are amazing. They're the ones that have some kind of like salmon DNA in them. I love wearing them on long flights because you wake up and your skin is like glass skin. And then this is their new mask. It's their turmeric brightening gel mask. So I think we'll wear this one tonight.
We have
acid, turmeric, and
extra,
I've seen this
extra lecturer. Okay, thank you. Tip number 5: brushing teeth and flossing. Ask the patient to floss deeply, even below the gum line. Remind him that bleeding while flossing is a symptom of inflammation and that he should not stop flossing. However, he should immediately arrange a hygiene visit. And tip number 6: an old Taiwanese proverb says that you should only floss the teeth you want to keep in your mouth. Remember, if you want to make money from your patient and constantly treat them for tooth decay, don't teach them how to floss their teeth. Of course, with a smile. Additional hygiene tools. This is interdental brushes are especially effective for wide spaces between teeth. I always recommend the patient to use them if they have a problem with flossing, because sometimes spaces, interdental spaces, are too big to use a floss, so it's sometimes better to use interdental brushes. Single bundle toothbrushes are recommended for cleaning interdental spaces that are particularly difficult to access. Very good for orthodontic patients, especially when the patient wants to have a very good oral hygiene. He's flossing and brushing and have orthodontic braces. I always recommend them to start to use a single bundle toothbrushes. They are very good, but you need to spend more time to clean the braces. Irrigators are mainly used for massaging the gum, cleaning the surface under bridges, cleaning the gums around implants, and cleaning orthodontic brackets. It's not the irrigators. You cannot use them when you don't want to floss. It is additional way to clean your teeth. So flossing is the most important, then also irrigating as a massage. Additional hygiene tools is also, it is worth to remember about dental floss. Super floss is used for cleaning under bridges and between orthodontic braces, so it's the different kind of floss. The instruction of oral hygiene should be conducted individually and last approximately 20-30 minutes. I know it's long, but you need to spend time. Maybe if not you, maybe it's your hygienist, but patients love to listen and need them from time to time. Practically every time we meet the patient during follow-up visit, the instruction should be repeated, sometimes supplementing with a new elements. You need to pay special attention to ask patient if there are any tooth surface that are difficult for them to clean, and show them from time to time how to clean hard to reach places. During the instructional visit, the dentist should use technical aids. However, the best results are achieved by independent brushing, flossing exercise conducted in front of the mirror under the supervision of a doctor. Remember, patients who cannot take care of their teeth may feel embarrassed, humiliated, or irritated. Improperly conducted instruction can have the opposite effect because no one likes it when attention is drawn to the inappropriate behaviors. Most people have basic knowledge of this subject, know how often and for how long to brush their teeth, have access to good toothpastes and toothbrushes, and know the principles of oral care, but they usually do not apply them in everyday practice. The issue of patient motivation to perform oral hygiene procedure is extremely important because if the patient approaches in it at this respectful manner, all our efforts will be doomed to failure from the very beginning. So it's very important, especially when we are running a prosthodontic treatment, orthodontic treatment, remember about oral hygiene instruction and motivation. Be aware that patients have different personalities. Each of them should be treated individually, depending on the patient age, intellectual level, education, gender, profession, as well as the current condition of the oral cavity and tooth. Different arguments should be used in motivation. Adult patients should be made aware of the importance of hygiene in social and professional contexts and the economic aspect of prevention. Patients also should be convinced that the proper oral hygiene is a personal responsibility of every person. Demonstrating the presence of plaque by staining is motivating for the patient, but it's even better to, for example, professional clean of tooth, the front tooth before staining. This allows us to better understand the connection between oral hygiene and the development of dental plaque. I sometimes recommend patients to use the stitching toothpaste. It's best way to use it from time to time in the home when they brush once a week. It not only helps them to see the plaque, but also helps them to improve the brushing skills. Also for you, if you want to, you should buy it and try it. And sometimes it shows you that you are not the master of brushing, so be aware of this and maybe try it. After the instruction, it's necessary to periodontally check the recommendation provided. We conduct the first such test after a few days. The patient brings his new toothbrush and toothpaste to the office. This way, we have the opportunity to check whether they are constantly with the recommendation. Then the patient demonstrates the brushing technique in front of the mirror. This allows us to correct any errors. It's also improper to stain dental deposits and assess the effectiveness of tooth cleaning by calculating the oral hygiene index. It both should be recorded in the medical card. In the office, it is more convenient to use alkaline fucosin solution or ready-made preparation, for example, red coat, caries test, or plaque test. While erythrosine tablets are good for self-checking for dental plaque performed by the patient at home. Or this toothpaste that I showed you on the previous slide. Using a mirror allows you to better see the colored plaque from the tongue or palate. And preventive medical and dental procedures, primary prevention, consolidation of health, prevention of disease. Secondary prevention is early diagnosis and treatment of people who have already fallen extensive diagnosis of the disease and combating infections. And tertiary prevention is stopping and preventing the recurrency of the disease process that has been cured. Home and professional prevention. After professional mechanical cleaning of teeth with a rotary brush, sandblasting, scanning, and polishing of tooth crowns and necks, contact fluoride treatment should be used. Sometimes, in my opinion, it is better to not use a fluoride product. It's sometimes better to use a calcium product. For example, it's a tooth mousse, and it also protects from caries, but also helps to mineralize improve the mineralization of the tooth. And it's the last slide. So thank you very much for today. We will hear and see next week. Just give me a few seconds.